That was my concern as well, just mindfulness and just having kind of a non-stressful, peaceful as much as we can
And as far
environment,
as
right?
you're concerned, you said you were worried about having to be responsible for setting that all up.
Yeah, and I guess that was going in, those were my thoughts, you know.
Well, and some of that is true.
You know.
There are some supplies to
Yeah.
gather, just like you're gathering supplies for having a baby in your
Yes.
house. And, your midwives will come and help you go through that. But really, the midwives look after setting everything up. Just so
Yeah.
you know. That's not really, you have to, take the supplies home from the clinic, and you have to have a bowl for the placenta and a heating pad maybe, and a fresh set of seats, you still have to pack a hospital bag. It's not.
I originally thought it would be maybe potentially simpler to go to the hospital, but now it almost seems I feel like it might be the other way. So.
Well, a lot of it is you don't know what you don't know.
You mentioned a while back you work with the hospital and other health providers there and stuff. Like, might be against silly questions, but
No,
are
there's
you
no silly
are you
questions.
phoning, like if you have to phone ahead, are you phoning 911
Very-
yourself, or do you have a
very-
midwife phone?
Very good question. So when you go into labor, you'll call your midwife, and you'll decide between whoever's on call will come when you're active, and we'll be there with you. If you're talking about transfer now, is that what the question is?
If you have to transfer to the hospital.
So we are on staff at the hospital, so we're part of the team already at the hospital, right? So if usually the standard that we have here is that whenever we have someone who's in labor at home, even if they have no complication, we call and let the hospital know that we are with so-and-so, and they already have your records because you've been pre-registered, and we're with so-and-so. She's entering her active labor. She's about 5 centimeters. She's planning a home birth. So you're part of it. You're part of their board. They put you up on their board there. So you're part of their catchment. They're thinking of you as somebody who they may have to reserve resources for. And then when you deliver, normally we call and say, she delivered, and they say, great. And, the boy, everybody's healthy. Or if we then instead call and say, okay, usually we won't call and say, we're coming in right now. Usually we'll say, okay, she's progressing, but we may be coming in. She may need an augmentation, or we're concerned, or maybe we'll call and speak to one of the consultants and say what we're seeing, or maybe we'll call and say, okay, we're going to, as I said, mostly it's for failure to progress, but if there was something else, say we hear a funny heartbeat, or you're bleeding a little bit more, then we would give them that report over the phone ourselves. If it's something that we are having to handle, remember I told you there are 2 midwives. So one of the midwives will do the call, and the other one will be providing the care. Rarely the father or the doula is involved in making that care. If it's a true emergency, say you're in the middle of delivery, it's a breech, or there's an unexpected twin or something like that, then you might get enlisted. We do prior, when we do the prenatal home visit, we do walk through how do you get, what's the best route to the hospital, where do we park, where can we put things, and we always ask you to post your emergency numbers, your pediatrician, your family doctor, or your midwives numbers, and those are somewhere accessible, so that anybody, in the heat of the moment, someone doesn't have to forget those things. But as I said, we have a relationship with the hospital. They know when we call in, they're used to doing this, and they will streamline the process. And there are many things, say in the highly unlikely event that you would be at home and have to go straight to surgery, which really, most of the time, if we think that you might be a candidate for something like that, we have already transferred, and you're in the hospital for a few hours before anything like that happens. So, but in the highly unlikely event that happens, there are certain things that you have to do to prep a woman. As I said, you have to start an IV, you have to, we have to tell you what's going to happen, they have to get the OR ready. That can all happen when you're en route, right? Because we've already let them know.
Okay.
It's comforting to know.
Remember,